Understanding bacterial diseases, causes, transmission, and treatments. Hello, everyone. Welcome to Nursing and Me. I'm so glad you're here today. In this video, we're diving into a fascinating topic on diseases caused by bacteria. Let's begin by exploring bacterial diseases. These little troublemakers called bacteria are tiny organisms. While some are harmless or even helpful, others can make us quite ill. But don't worry, for every challenge, there's hope and healing. Let's talk about these diseases, their causes, transmission, and the care that can bring relief. Tuberculosis, or TB, is a serious illness that often targets the lungs. It spreads through airborne droplets when an infected person coughs, sneezes, or speaks. Early diagnosis makes all the difference. With antibiotics like rifampin and isoniazid, we can tackle this infection effectively. Pneumonia inflames the air sacs in your lungs, sometimes filling them with fluid. It's commonly caused by bacteria such as Streptococcus pneumoniae and can be transmitted through respiratory droplets or contact with infected surfaces. Antibiotics like amoxicillin or azithromycin, coupled with rest and hydration, work wonders in bringing relief. Strep throat, caused by Streptococcus pyogenes, spreads through respiratory droplets or direct contact with an infected person. This infection responds well to antibiotics like penicillin. A warm saltwater gargle is a simple yet soothing remedy to ease the discomfort. Cholera, caused by Vibrio cholerae, leads to severe diarrhea and dehydration. It spreads through contaminated water or food. The key to recovery is oral rehydration therapy and antibiotics like doxycycline. Clean water and sanitation are our greatest allies in preventing it. Typhoid fever caused by Salmonella typhi spreads through contaminated food or water. Practicing proper hygiene is critical. With the right antibiotics, such as ciprofloxacin, this illness can be effectively treated. Leprosy, caused by Mycobacterium leprae, spreads through prolonged contact with an infected person's respiratory droplets. This chronic infection affects the skin and nerves. With multi-drug therapy recommended by the WHO, it's entirely treatable. Compassion and timely care can transform lives. The plague caused by Yersinia pestis is rare but serious. It is often transmitted by fleas that have bitten infected animals. Prompt treatment with antibiotics like streptomycin and isolating patients ensures safety and healing for all. Anthrax, caused by Bacillus anthracis, can affect the skin, lungs, or gastrointestinal system. It spreads through contact with infected animals or contaminated products. Antibiotics like ciprofloxacin and antitoxins are effective in managing this infection. Awareness and early intervention are key. Botulism, a rare poisoning caused by toxins from Clostridium botulinum, is often linked to improperly canned or preserved foods. Swift care with antitoxins and supportive treatments, such as ventilation when needed, can save lives. Whooping cough, caused by Bordetella pertussis, spreads through respiratory droplets. Antibiotics like azithromycin and the DTaP vaccine provide protection and relief. Vaccination is a gift we give to our community. Gonorrhea, caused by Neisseria gonorrhoeae, is a sexually transmitted infection. It spreads through unprotected sexual contact. Antibiotics like ceftriaxone and azithromycin are highly effective. Let's reduce stigma and encourage testing and treatment. Syphilis, caused by Treponema pallidum, progresses in stages if left untreated. It spreads through sexual contact or from mother to child during pregnancy. Penicillin is highly effective even in late stages. Early diagnosis is vital for full recovery. Bacterial meningitis, often caused by Neisseria meningitidis or Streptococcus pneumoniae, attacks the brain's protective membranes. It spreads through respiratory droplets. This medical emergency requires urgent antibiotics like ceftriaxone and corticosteroids to ease inflammation. Timely action saves lives. Lyme disease, caused by Borrelia burgdorferi, is transmitted through tick bites. Antibiotics like doxycycline or amoxicillin in the early stages can resolve it quickly. Awareness and prevention make all the difference. Tetanus, caused by Clostridium tetani, enters the body through cuts or wounds contaminated by soil or feces. It causes muscle stiffness and spasms. Tetanus immunoglobulin, antibiotics, and vaccination provide a strong defense. Let's keep our vaccines up to date to stay protected. Scarlet fever, caused by Streptococcus pyogenes, spreads through respiratory droplets or direct contact. Its red rash and high fever respond beautifully to antibiotics like penicillin. Supportive care for symptoms can also provide much-needed comfort. Brucellosis, caused by Brucella species, spreads through unpasteurized dairy products or direct contact with infected animals. A combination of antibiotics like doxycycline and rifampin ensures recovery. Proper handling of animal products is essential. Chlamydia, caused by Chlamydia trachomatis, is a sexually transmitted infection. It spreads through unprotected sexual contact. It is treatable with antibiotics like azithromycin or doxycycline. Let's normalize conversations about sexual health for better care. Legionnaire's disease, caused by Legionella pneumophila, is transmitted through inhaling contaminated water droplets from sources like cooling towers or hot tubs. Antibiotics like levofloxacin or azithromycin work effectively. Clean water systems play a vital role in prevention. Salmonella infections, caused by Salmonella bacteria, spread through contaminated food, particularly undercooked eggs or poultry. Staying hydrated is crucial, and in severe cases, antibiotics like ciprofloxacin provide additional support. Safe food handling is our best defense. Thank you for watching. If you found this video helpful, please like, share, and consider subscribing for more content. See you in the next one.